Bismillahirrahmanirrahim. A quote of the day is from Rumi that you don't know yet. It's your light that lights the world. Today, the topic of my presentation is tetanus, and I'm presenting it under the supervision of Professor Dr. Saira Asif. Learning outlines. Learning outlines of the presentation are introduction of tetanus, epidemiological triad, chain of transmission, clinical stages, levels of prevention, and recent advances, along with MCQ session at the end. Learning outcomes. At the end of this presentation, participants will be able to describe about the introduction, epidemiological triad, chain of transmission, clinical stages, along with the levels of prevention of redness. Introduction. An acute disease that is induced by exotoxins of Clostridium tetani and clinically characterized by muscular rigidity, which persists throughout illness, punctuated by painful paroxysmal spasm of the voluntary muscles, especially the masseter, trismus or lockjaw, the facial muscle that is rhizus sardonicus, and the muscles of the back and neck, that is opisthotonus, and those of the lower limbs and abdomen. The mortality tends to be very high, varying from 40 to 80%. Problem statement. Tetanus is now comparatively rarely disease in the developed countries. Neonatal tetanus is a killer disease, second only to measles among the 6 target diseases of EPI. Even with treatment, the case fatality rate can be as high as 80 to 90%. It tends to occur in areas with poor access to healthcare, hence, it often remains hidden within the community. During 2012, a total of 10,392 cases of tetanus and 4,650 cases of neonatal tetanus were reported to WHO worldwide. Epidemiological triad. Now, this is a triad in which 3 factors are involved: agent factor, host factor, and environmental factors. In the agent factor are biological, nutritional, physical, chemical, and mechanical factors. Host factors are age, sex, genetic, profession, custom, habits, and behavior. And environmental factors are biological, physical, and social factors. Agent factors. Agent is Clostridium tetani, a gram-positive anaerobic spore-bearing organism. The spores are terminal and give the organism a drumstick appearance. The spores are highly resistant to a number of injurious agents, including boiling, phenol, cresol, autoclaving for 15 minutes at 120 degrees centigrade. Reservoir of infection. The natural habitat of the organism is soil and dust. The bacilli are found in the intestine of many herbivorous animals, for example, cattle, horse, goat, and sheep, and are excreted in their feces. The spores survive for years in nature. The bacilli may be found frequently in the intestine of man without causing infection or ill effects. The spores are blown about in the dust and may occur in the wide variety of situations, including operation theaters. Exotoxin. Tetanus bacilli produce a soluble exotoxin. It has an astounding lethal toxicity that is exceeded only by botulinum toxin. The lethal dose for 70 kilogram man is about 0.5 milligrams. The toxin acts on 4 areas of nervous system. First is the motor end plate in the skeletal system. Second is the spinal cord. Third, brain, and fourth is the sympathetic system. The principal action of this organism is to block inhibition of spinal reflexes. Period of communicability. Period of communicability is none. It is not transmitted from person to person. Host factor. Age. Commonly, tetanus is a disease of the active age, that is 5 to 40 years. This period predisposes to all kinds of trauma, and therefore, the risk of acquiring the disease is very high. Sex. Although a higher incidence is found in males, females are more exposed to the risk of tetanus, especially during delivery or abortion, leading to puerperal tetanus. Males appear to be more sensitive to tetanus toxins than females. Occupation. Agricultural workers are at special risk because of their contact with soil. Rural and urban differences. The incidence of tetanus is much lower in urban than in rural areas. Within the urban areas, there may be vast difference in the incidence of tetanus. Immunity. No age is immune unless protected by previous immunization. The immunity resulting from 2 injections of tetanus toxoid is highly effective and lasts for several years. Immunity lasting for few weeks, less than 6 months, can be transferred to the baby if the mother is immunized during pregnancy or if she already has a higher level of immunity at the time she was pregnant. Tetanus is one disease in which herd immunity does not protect individuals. Environmental and social factors. Tetanus is a positive environmental hazard. Its occurrence depends upon man's physical and ecological surroundings. The environmental factors are compounded by social factors such as unhygienic customs and habits, for example, application of dust or animal dung to wounds, unhygienic delivery practices, for example, using unsterilized instruments for cutting the umbilical cord, and ignorance of infection and lack of primary healthcare services. Mode of transmission. Infection is acquired by contamination of wounds with tetanus spore. The range of injuries and accidents by which this can lead are option A is at first is trivial pinprick, second skin abrasion, punctured wounds, burns, human bites, animal bites, stings, unsterile surgery, intrauterine deaths, bowel surgery, dental extractions, injections, unsterile division of umbilical cord, compound fractures, otitis media, chronic skin ulcers, eye infection, and gangrenous limbs. Incubation period is usually 6 to 10 days. However, it may be as short as 1 day or as long as several months. Long incubation is probably explained by the spores lying dormant in the wound. Incubation is also prolonged by prophylaxis. Pathophysiology. Tetanus is an infectious disease that is caused by Clostridium tetani bacteria. The active anaerobic bacteria leads to the production of tetanus toxin, which enters the nervous system via the lower motor neuron and travels up to the spinal cord and brainstem. The spores become active bacteria that spread in the body and make a poison called tetanus toxin, also known as tetanospasmin. This poison blocks nerve signal from the spinal cord to the muscles, causing severe muscle spasm. The spasm can be so powerful that they tear the muscle or cause fractures of the spine. Clinical feature of the disease. On average, it takes between 7 to 10 days after infection of the symptoms of tetanus to develop. These symptoms can appear anywhere between 4 to 21 days after a person has been infected. The first symptom of the tetanus are usually stiffness and mild spasm in the jaw muscle, jaw cramping. Second, involuntary muscle tightening, often that is in the stomach, and painful muscle stiffness all of the body is seen. Trouble swallowing, jerking or steering, seizures, headache, fever and sweating, changes in the blood pressure and fast heart rate. Types of tetanus. Traumatic tetanus. Trauma is a major and important cause of tetanus. Sometimes tetanus may result from most trivial or even unnoticed wounds. Puerperal tetanus follows abortion more frequently in a normal labor. A post-abortal uterus is a favorable site for germination of tetanus spores. Autogenic. Ear may be a rare portal of entry. However, foreign bodies such as infected pencils, matches, beads may introduce the infection. Autogenic tetanus is a pediatric problem, but cases may occur in adults also. Idiopathic. In these cases, there is no definite history of sustaining an injury. Some consider it to be the result of microscopic trauma. Neonatal tetanus. Neonatal tetanus or tetanus neonatorum is a generalized tetanus that results from infection of a neonate. It primarily occurs in underdeveloped countries and accounts for as many as half of all the neonatal deaths. The first sign of tetanus in the neonate is usually the inability to suck or breastfeed and excessive crying. The characteristic features of tetanus are trismus, that is lockjaw or inability to open the mouth, risus sardonicus, that is forced grin and raised eyebrows, and opisthotonus, that is backward arching of the spine. No specific laboratory tests exist for determining the diagnosis of tetanus. The diagnosis is clinically based. However, the pro-tetanus test kit can be used to determine whether the individual patient has a sufficient level of immunity to be protected against tetanus or not. It's used in Europe under the name tetanus quick test stick, and it has been validated against ELISA measurement of serum tetanus antitoxin level. TQS takes 10 minutes to read and are 100% specific for tetanus antibodies. If the test is positive, you can assume that patient has protection against tetanus for at least 5 years. Sensitivity is 55% for titers and 0.01 international unit per ml, but 100% more if titers are more than 0.5 international unit per ml, which is 5 times greater than the accepted protective limit of 0.1 international unit per ml. Levels of prevention. 4 basic levels of primordial prevention: primary prevention, secondary, and tertiary prevention. First is health promotion, that comes in primary prevention. Tetanus germs can enter the skin through something as small as pinprick, but they prefer deep wounds. Clean any wound that you get with soap and water. Use any antiseptic. If the wound is deep or dirty, have your doctor check it out. If you haven't had a tetanus booster in more than 5 years, you may need to get another booster. Be sure to give your vaccine record to your healthcare provider. A specific protection. Tetanus is best prevented by active immunization with tetanus toxoid. It stimulates the production of protective antitoxin. The aim should be to vaccinate the entire community and ensure a protective level of antitoxin, approximately 0.1 international unit per ml serum throughout life. All persons should be immunized regardless of age. Two preparations are available for active immunization. Uh, A is combined vaccine, DPT, or B is monovalent vaccine. Two are included in it: plain or fluid, that is formal toxoid, and tetanus vaccine or absorbed vaccines. Combined vaccine. The primary course of immunization consists of 3 doses of DPT at intervals of 4 to 8 weeks, starting at 6 weeks of age, and followed by a booster of 18 months of age, and a second booster only of tetanus toxoid at 5 to 6 years of age, and a third booster only of tetanus toxoid after 10 years of age is given. Monovalent vaccine. A primary course of immunization consists of 2 doses of tetanus toxoid absorbed, each dose 0.5 ml injected into the arm, given at interval of 1 to 2 months. The longer the intervals between the 2 doses, the better is the immune response. The first booster dose, third in the order, should be given a year after the initial 2 doses. A purified tetanus toxoid should be stored between 4 to 10 degrees centigrade. It must not be allowed to freeze at any time. Passive immunization. Temporary protection against tetanus can be provided by an injection of human tetanus hyperimmunoglobulin. Human tetanus hyperimmunoglobulin is the best prophylactic to use. The dose for all ages is 250 units. It does not cause serum reactions. It gives a longer passive protection up to for 30 days or more compared with 7 to 10 days of forced ATS. ATS or equine. If human antitoxin is not available, equine antitoxin, that is anti-tetanus serum, or ATS should be used. The standard dose is 1500 international units, injected subcutaneously after sensitivity testing. ATS gives passive protection for about 7 to 10 days. Being a foreign protein, ATS is rapidly excreted from the body, and there may be very little antibody at the end of 2 weeks. Active and passive immunization. Simultaneous active and passive immunization is widely carried out in a non-immune person. The patient is given 1500 units of ATS or 250 units of human immunoglobulin in one arm and 0.5 ml of absorbed tetanus toxoid into the other arm or gluteal region. This should be followed 6 weeks later by another dose of 0.5 ml of tetanus toxoid and a third dose 1 year later. Adults should get a diphtheria tetanus booster once every 10 years throughout their life. This is true even if you don't have a wound. Getting a tetanus diphtheria booster every 10 years applies if you have a minor clean wound. Antibiotics. A single intramuscular injection of 1.2 mega units of long-acting penicillin will provide a sustained contraction of the drug for 3 to 4 weeks, which is sufficient to kill any vegetative form of tetanus bacilli that may emerge from sporulating stage. Penicillin has no effect on tetanus spores. Prevention of neonatal tetanus. In unimmunized pregnant women, 2 doses of tetanus toxoid should be given. The first as early as possible during the pregnancy, and second at least a month later, and at least 3 weeks before delivery. Immunized pregnant women, a booster dose is considered sufficient, and there is no need for booster at every consecutive pregnancy because of the risk of hyperimmunization and side effects. This picture shows for the recommendation for prevention of redness in the wound that all wounds receive surgical cleaning. That there are some wounds that are less than 6 months old, 6 hours old, clean, non-penetrating, and with negligible tissue damage. So this key figure shows for the other wounds and these wounds. Secondary prevention is that tetanus has no definite cure, but it can be treated with surgery to clean an infected wound. It's also treated with anti-tetanus, an anti-spasm medicine, and antibiotics. You may need to be on breathing machine or ventilator until you can breathe well on your own. Tetanus is treated in ICU intensive care unit. Even with modern medical care, tetanus can be fatal. From 1 in 10 to 1 in 5 people with tetanus may die from it. Complications can include breathing problems, broken bones, blood clots, and pneumonia. For people who survive, recovery can take several months. Nerve damage may take even longer to heal. It may be long term or permanent. Recent updates. An article recently published is a progress towards maternal and neonatal tetanus elimination worldwide from 2000 to 2018. The points that were of concern are there has been significant progress globally to eliminate maternal neonatal tetanus, and approximately 75% of the 59 priority countries were validated to have achieved maternal neonatal tetanus elimination by the end of 2018. The intensive targeting of high risk areas and districts reached an estimated 154 million women of reproductive age. Clinical factors contributing to the success include improvement in women's access to education, country commitment to the implementation of recommended elimination strategies, timely availability of resources, good planning, and community engagement in elimination activities, strong monitoring and supervision of maternal neonatal tetanus elimination activities, and integrity delivery of antenatal care and tetanus vaccination services are required. This graph shows the trend of the disease that is continuously decreasing from 2000 to 2018. This graph shows the trend of women being immunized. This shows that the number of women who are being immunized in the age group of their reproductive age is continuously increasing from 2000 to 2018, and that is a positive trend. Another article published is Clinical Profile of Adult Tetanus Patient and the Impact of Early Tracheostomy on the Outcome, that is a retrospective observational study. It was concluded that patients who underwent early tracheostomy had better survival and low risk of being mechanically ventilated and development of ventilator-associated pneumonia. Periodic estimation of creatinine phosphokinase level can be used as a valuable prognostic tool and predictor of mortality in tetanus patients. Age, any comorbid situation, mechanical ventilation, and complications were the probable risk factor. Overall, we had a good rate of survival on the patients that were having early tracheostomy. Now coming towards the MCQ session. First MCQ is a patient admitted in the psychiatry ward all of a sudden started to act sick and made contractions of his body. Some junior medical staff considered him to be having tetanus. Which among the following is not a common symptom of tetanus? Option A is decreased heart rate. Option B is sweating and fever. Option C difficulty swelling, and option D is muscle spasm.
B.
Option A is the right one. Because heart rate is faster in the patient of tetanus and there is always tachycardia. Second MCQ. A farmer ABC was working in the field while he was doing that barefooted. He got a minor injury on his feet. There was a little bleeding from that side. Best step to be taken during this situation is option A, immediately go to tertiary care. Option B, wash and take some rest. Option C, wash wound and go to nearby doctor. And option D, ignore this little wound.
B.
A.
C.
Option C is the right one. That wound should be washed and the person should go to nearby doctor for checking the status of his vaccines and status. Third MCQ is females are more exposed to the risk of tetanus, especially during delivery or abortion, leading to puerperal tetanus. When can a woman with tetanus pass this disease to another person? Option A, after delivering the placenta. Option B, from an open wound. Option C, while the scar of the wound is visible. And option D, when fever is settled.
B.
Option B is the right one. Yes, from an open wound, any person can transfer the tetanus disease to the other. Fourth MCQ is the pro-tetanus test kit can be used to determine whether an individual patient has a sufficient level of immunity to be protected against tetanus. That kit is said as TQS in most developed countries. Regarding tetanus quick check, which of the following is true? Option A is that they take 1 hour to read. Option B, if the test is positive, the patient has contracted tetanus. Option C is they are 100% specific. And option D, they're 80% sensitive for titers of 0.01 international rate per ml.
A.
D.
Option C is the right one. They are 100% specific. Fifth MCQ is a person after falling from tree got injured on the big toe. He is at the great risk of getting tetanus. That is an acute disease induced by exotoxin of Clostridium tetani. Tetanus is best prevented by active immunization. The immunization drug belongs to which group? Option A is live attenuated vaccine. Option B is heat killed vaccine. Option C, formalin killed vaccine. D is toxoid.
B.
B.
Delta.
Option D is the right one. Toxoid is the answer. Sixth MCQ is tetanus is a very dangerous infection that is caused by Clostridium tetani. Very rarely a person can get exposed to that through an intact skin. Once exposed to the infection, a person can develop this disease in as little as how many days? Option A is on the very first day. Option B is 4 days. Option C is 10 days, and option D 1 month. First day.
B.
Option B is the right one because the incubation period for the disease and the symptoms start from 4 to 21 days. So as little as minimum time is 4 days. Seventh MCQ is a child born to an unimmunized woman was having neonatal tetanus and died in a week. That woman was then immunized after that. Which among the following is recommended for her subsequent pregnancies to be prevented from tetanus? Option A is 2-dose vaccine before delivery. Option B, tetanus toxoid before last 30 days of delivery. Option C is no vaccine is required at all. And option D, booster should be given once.
Alpha.
A.
A.
Option D is the right one because that woman was immunized after her first pregnancy. So in subsequent pregnancies, booster should be given. If she was not immunized, then option A was right. Eighth MCQ is a neonate admitted in the nursery of Mayo Hospital is having difficulty breathing and might need mechanical ventilator support system. Diagnosed as neonatal tetanus, that is tetanus neonatal, the first sign of the disease is option A is forced grin, option B is raised eyebrow, option C is decreased cry because of tense muscle, and option D is inability to suck breast milk.
D.
D.
Option D is the right one. There is inability to suck breast milk. Ninth MCQ is a cold chain is a low temperature controlled supply chain. An unbroken cold chain is an uninterrupted series of refrigerated production, storage, and distribution of activities. For tetanus toxide, the appropriate temperature should be option A is 4 to 7 degrees centigrade, option B is 4 to 7 degrees Fahrenheit, option C is freezing is ideal for this, and option D is no cold chain required.
A.
Yes, A is the right answer. 10th MCQ is a single intramuscular injection of 1.2 megaunits of long-acting penicillin will provide a sustained contraction of the drug for 3 to 4 weeks, and it might help in relieving the symptoms of the disease. Regarding penicillin, option A, it acts directly on the spores of Clostridium. Option B, it is given to reduce superimposed bacterial infection. It acts on the vegetative form of Clostridium. And option D, it should be used hand in hand from the very beginning.
C.
Option C is the right one.
D.
Penicillin acts on the vegetative form of Clostridium tetani. This is the key, and thank you.
Thank you very much, Dr. Isma. Very nice